UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, welcome to UroPatient, where we provide simple, practical education to help you manage your urologic health with confidence. Hey, don't forget to like and subscribe. If you or a loved one uses a urinary catheter, keeping the catheter drainage bag clean is one of the most important steps in preventing infection and keeping your system working properly. Many patients have asked, how often should I clean my bag? What should I use? And what's the safest way to do it? In today's episode, I'm going to walk you through how to properly clean your catheter drainage bag, including simple supplies you can use at home, how often cleaning should be done, and tips to help reduce the risk of urinary tract infections. I'm Vic, and this is UroPatient, helping you understand urologic care so you can live healthier and more comfortably. So let's get started.
Welcome. We're going to walk through everything you need to know to manage your urinary catheter and drainage bags, all from the comfort of your own home. Our goal here is to give you clear, practical steps so you can handle your care with total confidence. Okay, let's just start by saying it out loud. Managing a catheter, especially when it's new, can feel like a lot. You've got new equipment, a new routine, and it is perfectly okay to feel a little bit overwhelmed by it all. But here's the good news. It really doesn't have to be that complicated, I promise. Once you have the right info and get into a steady routine, you can absolutely handle this. You've got this. And that is exactly why we're here today. We're going to break it all down piece by piece, so you have a simple step-by-step guide to follow for managing everything safely. All right, so let's dive in. Before we even get to the how-to, we need to understand the why. And the biggest why behind all of this is preventing the number one risk, which is something called a CAUTI. So, what in the world is a CAUTI? Well, it stands for catheter-associated urinary tract infection. You can think of it like this. Germs can sometimes use the catheter as a little highway to get into your urinary system, and that can cause an infection. Our main goal is to put up a roadblock, and good hygiene is how we do it. So how do you know if an infection might be starting? Well, your body sends out warning signs. Think of this as your personal checklist. Are you feeling feverish? Is there any new pain? Take a look at your urine. Does it look cloudy or have a strong smell? These are all signals to pay attention to. And that brings us to the most powerful tool you have for stopping a CAUTI before it even starts, a simple daily cleaning routine. This is where you really take control of your health. And you know what? You don't need any fancy, expensive supplies. You can make some really effective cleaning solutions right in your own kitchen. As you can see here, a simple bleach and water mix is a powerhouse for killing germs. Or a vinegar and water solution is fantastic for breaking down any of that cloudy, crystal-like stuff that can build up. All right, let's walk through the cleaning process. It's pretty easy. First things first, always wash your hands. Then, after you empty the bag and give it a quick rinse with regular water, you'll pour in your cleaning solution. Really give it a good swish for about 30 seconds to make sure it coats everything inside. Then just set it aside and let it sit for about 15 to 20 minutes. Okay, so once that time is up, go ahead and pour the solution out. Now, this next part is really important. You have to rinse the bag and the tubing really well with clean water. We want to make sure every last bit of that cleaning solution is washed away. And here we are, the final step in cleaning. You're just going to hang the bag up to air dry. The key here is to leave the little spout at the bottom open and pointing down. That way, gravity can pull all the moisture out, and germs will have nowhere to grow. Simple as that. Okay, so you've got the cleaning routine down pat. Awesome. Now let's talk about something else you'll do pretty regularly, safely switching between your different drainage bags. You know, like going from your smaller daytime bag to the bigger one you use overnight.
And here's what they typically look like. The smaller one is your leg bag. It's more discreet and lets you move around easily during the day. The larger one is your night bag. It can hold a lot more, so you don't have to worry about waking up to empty it.
So, how do you make the switch? It's a straightforward process. First, get all your supplies ready to go. Then, wash your hands, empty the bag you're taking off, and maybe place a towel underneath just in case of any drips. The trick is to gently pinch the catheter tube closed to stop the flow, then use a little twisting motion to disconnect the old bag. Okay, everybody, listen up, because this is the single most important part of the whole process. This is our big infection prevention step. Before you connect anything new, you have to take a fresh alcohol pad and scrub the tip of your catheter and the connector on the new clean bag. We want that connection to be as sterile as possible. Once both ends are clean, you just connect the new bag with that same firm twist until it feels secure. You don't want any leaks. Get it situated so it's comfortable, and what's the very last step? You guessed it. Wash your hands one more time. Now, in a perfect world, everything would always work perfectly. But in the real world, sometimes little hiccups happen. So let's talk about a couple of the most common issues you might run into and the super quick ways to fix them.
Let's say you look down and you notice urine isn't flowing into your bag. Okay, don't panic. 9 times out of 10, it's a simple plumbing issue. The very first thing to check is the tubing. Is it twisted up? Did it get kinked? Are you maybe sitting on it by accident?
The fix is usually just as simple. Just follow the tube and straighten out any kinks you find. And remember the golden rule: gravity is your best friend here. The bag must always be hanging lower than your bladder for it to drain properly.
Okay, another really common one: letting the bag get a bit too full. We've all done it. A full bag isn't just heavy and uncomfortable, that weight can actually start to pull on the catheter, which we definitely want to avoid.
So, a great habit to get into is just emptying the bag when it looks about half or maybe 2/3 full. It's a small, proactive thing you can do throughout the day that prevents leaks and stops any of that uncomfortable pulling. It's just safer and more comfortable all around. And finally, let's talk about something that's incredibly important. We've covered the quick fixes, but now we need to be crystal clear on the signs that mean you should stop troubleshooting and pick up the phone to call your doctor or nurse.
These here are your red flags. If your catheter accidentally comes out, don't try to fix it yourself. Call. If you spike a fever, see blood, or anything that looks like sand in your urine, call. If you have any of those CAUTI symptoms we talked about earlier, you call. And honestly, even if you just have questions or feel unsure, it is always better to be safe and make that call. And that's really it. By understanding these key steps, how to clean, how to switch bags, how to fix those little problems, and when to ask for help, you are totally equipped to manage your own care. This isn't just about a list of rules. It's about giving you the knowledge and the power to take control of your health and to live well. You can do this.
All right. So that was pretty instructional. I did that with the help of AI. I'm going to admit that. But it's all my work, so I guess it counts. I'm going to go through a couple of these cleaning solutions with you just real quick here. White vinegar. Yeah, you can dilute it. One part vinegar, 3 parts water is typical what I use. It does kill bacteria. It reduces odor. Of course, it smells like vinegar. And real simple, you pour the solution into the bag, swish it around. I'm going to go over some instructions on how to get into your bag to do this. Drain, rinse, let it air dry. Now, this assumes you have 2 bags, and you should have a spare bag. We don't recommend using apple cider vinegar. And the other thing is, if you're noticing a lot of sandy-like material, these are crystals, the vinegar is the best one for getting rid of those. The other one is diluted bleach. I'm not a big fan of bleach myself because I've had a couple patients not properly wash the bag off, and they left bleach on it, and they ended up with a burn on their leg from their leg bag having bleach transferring to their skin. It's a great solution, but I have to caution you, I use it with a whole lot of caution. Definitely got to have it diluted. A tablespoon of bleach into a half a cup of water. So it's a very mild solution. Don't be using it straight. Pour it into the bag, shake, swish, let it sit for 30 minutes, drain, rinse, 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 rinse. And unscented household bleach is really the best one to use. But again, a word of caution, if you don't be careful, you could get a skin burn from the bleach. Haven't seen it happen with vinegar. Now, the simplest thing, mild soap and water. I'm a big fan of Dawn dish detergent because it cleans anything. But any dish detergent probably good. A simple liquid, mild soap and water. You can run that through. That's going to help disinfect it too. Works really well. Same situation with hanging it out to dry. Now, here's one you may not have thought of, and I did. I can tell you that you can see that there's all evidence-based markings here where these things came from when I did my research. But this one I didn't find in the research, but I've told a lot of patients to do it. Listerine was formulated in 1879 by a guy named Joseph Lawrence, who was a chemist, and he was inspired by work from Joseph Lister, a British surgeon known for pioneering antiseptic surgery way back then. And they developed this ingredient called Listerine, and it was initially developed as a surgical antiseptic intended to clean wounds and prevent infections. But you can put a little Listerine inside and you can use that full strength inside your bag, and it will do a great job of killing off bacteria, making it smell better, and give you kind of a little minty, fresh smell to it too. So all these are great cleaning solutions that you can try. No evidence for that one, but I can tell you I got a lot of patients who agreed that was a good one. So how do they compare? Again, vinegar, most common, removes odor and bacteria. The bleach and water, strong disinfectant, but word of caution. And then mild soap and water, just as basic cleaning. No ratio because you can use it straight. Now, here's the trick. How do you get that into the bag? Because you can't really work with it as is. You have to get one of these things called a Toomey syringe. Sometimes you can ask your doctor's office if they'll give you one, but you can buy them too. I'm going to go over some ways that you can buy them. But right now I'm going to go over how you work on your bag. I've got a bag here, and the trick to it is you want to give it a little twisting motion, like it said, to disconnect the two. Now, if you're going to do that, you're going to reconnect your catheter to another bag. Whoops. And I've got one here like that. All right. Or another option, if you don't want to have to connect it to another bag, and I've talked about these, are these catheter plugs. You can put a plug in your catheter temporarily so that you can work on your bag. Now, that said, once you've disconnected it and you've got your leg bag here, you can use that Toomey syringe, the one I showed you, to squirt the stuff right into the hole there. It's got a thin tip. It's called a catheter tip, and it'll fit in there. And then the same thing with this is if you've got the other bag for at bedtime, what we call our leg bag. Our bedside bag. This is the leg bag over here. So you got the two. Same thing. You want to clean these. They're going to get pretty funky smelling. And most of the time, catheters are changed about every 6 to 8 weeks. So they're not getting a lot of change. Now, in case you're wondering, where can I get all these things? I've got a website here. You can go to UroPatient.com. That's our website. And I started this little collection of the things I talk about because, people are trying to find these products and maybe they're hard to find. Now, these are available all through Amazon. You can, and these are two I didn't talk about, but these are some actual products. M9, which is a disinfectant by Hollister, a little more costly than the other stuff. You can see $30, but it cleans and deodorizes urinary systems. I've had patients that really had foul smelling bags and they went and used that solution and really liked it. The other one I've never used before, so I just noticed that there's something called Urolux. Again, still kind of an expensive product, but it looks like it's got the same stuff for treating, cleaning out bags. And then remember, I did mention you want to get these are called Toomey syringes, and the whole key is that tip that they have. You have to get one with that catheter tip on it. And they're pretty cheap, $5.99 for 4-pack. They're 60 cc's. That's perfect amount for doing any cleaning of your catheter. And then if you're worried about those little pieces I showed you, how you can block your catheter with these catheter plugs, you can get those again. And then maybe you need a spare bag because you don't have one. You can buy those. They're all, Amazon carries everything. I set up an affiliate account, mostly put in there just to, provide you guys with a place to find your different things that I talk about, because I've had a few people write in, hey, that's a great idea, but where do I get it? So I thought, well, if I set up an affiliate account, then I can put these recommendations in there. So UroPatient.com. Now we've got your supplies for you too. They're not coming from me. They're coming from Amazon, but I'm just affiliated with them. So I hope you found this helpful. We'll see everybody next week for more information about your urological health care as a patient, what you need to know. We'll see you next week.
From research updates to daily advice, Vic explains it all, simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.